Hello and welcome. Today we're diving into a complex neurological disorder known as tuberous sclerosis complex, or TSC. While relatively rare, TSC can have a profound impact on individuals and families. This video will explain what TSC is, its causes, symptoms, diagnosis, treatment, and what the future may hold for those living with this condition. So, what causes TSC? TSC is a genetic disorder, meaning it's caused by changes or mutations in a person's genes. Specifically, these mutations occur in either the TSC1 gene, which produces a protein called hamartin, or the TSC2 gene, which produces a protein called tuberin. These two proteins work together as a tumor suppressor complex, helping to regulate cell growth and division. In about 1/3 of cases, the mutation is inherited from a parent who has TSC. However, in the remaining 2/3 of cases, the mutation occurs spontaneously during conception, meaning neither parent has the condition. Now let's look at the pathophysiology, or how TSC affects the body. Because of the mutations in the TSC1 or TSC2 genes, the hamartin and tuberin proteins are either absent or dysfunctional. This leads to dysregulation of the mTOR pathway, a crucial signaling pathway involved in cell growth, proliferation, metabolism, and survival. With the mTOR pathway overactive, cells grow and divide uncontrollably, leading to the formation of benign tumors, called hamartomas, in various organs, including the brain, skin, kidneys, heart, and lungs. The location and size of these tumors determine the specific symptoms a person with TSC will experience. TSC is estimated to affect between 1 in 6,000 and 1 in 10,000 newborns worldwide. It affects people of all races, ethnicities, and genders equally. While the prevalence seems low, it's important to remember that many individuals may be undiagnosed or misdiagnosed, leading to an underestimation of the true number of people living with TSC. The signs and symptoms of TSC are highly variable, depending on which organs are affected and the severity of the tumors. Some individuals may have very mild symptoms, while others experience significant disabilities. Common symptoms include skin abnormalities like hypopigmented macules, also known as ash leaf spots, facial angiofibromas, and shagreen patches. Brain involvement can lead to seizures, developmental delays, intellectual disability, and autism spectrum disorder. Kidney involvement can result in angiomyolipomas, and cardiac rhabdomyomas are often found in infants. Lung involvement, known as lymphangioliomyomatosis or LAM, is more common in adult women. It's important to note that not everyone with TSC will experience all of these symptoms. Diagnosing TSC can be challenging, given the wide range of symptoms. Diagnosis is typically based on a combination of clinical findings, including the presence of specific skin lesions, brain abnormalities identified on MRI or CT scans, kidney lesions, and genetic testing. Diagnostic criteria have been established to help healthcare professionals make accurate diagnoses. Major features include facial angiofibromas or ungual fibromas, cortical tubers, subendomal nodules or giant cell astrocytomas, cardiac rhabdomyoma, lymphangioliomatosis, and LEM. Angiomyolipoma. Minor features include multiple confetti skin lesions, dental enamel pits, multiple renal cysts, retinal achromic patch. Definite diagnosis requires either 2 major features or 1 major feature with 2 minor features. Suspected diagnosis requires either 1 major feature or 2 or more minor features. Genetic testing can confirm the diagnosis by identifying a mutation in either the TSC1 or TSC2 gene. While there aren't distinct types of TSC based on specific genetic mutations, individuals can be categorized based on the predominant organ systems affected. For instance, some may have primarily neurological involvement, while others may have more significant kidney or lung involvement. This classification helps guide treatment and management strategies. Currently, there is no cure for TSC. Treatment focuses on managing the symptoms and preventing complications. Seizures are typically treated with anti-epileptic medications. mTOR inhibitors, such as sirolimus and everolimus, are often used to shrink tumors in the brain, kidneys, and lungs. Skin lesions can be treated with topical medications, laser therapy, or surgery. Early intervention services, such as speech therapy, occupational therapy, and physical therapy, are crucial for children with developmental delays. Regular monitoring and surveillance are essential to detect and manage any new or worsening symptoms. Because TSC is a genetic disorder, there's no way to completely prevent it. However, genetic counseling is recommended for individuals with a family history of TSC who are planning to have children. Prenatal testing may be available to determine if a fetus has inherited the TSC gene mutation. Early diagnosis and intervention can help improve outcomes for individuals with TSC. The prognosis for individuals with TSC varies greatly depending on the severity of the condition. Some individuals live long, healthy lives with minimal symptoms, while others experience significant disabilities and complications. With advancements in treatment and management, the prognosis for many individuals with TSC is improving. Recent research is focused on developing new therapies that target the underlying genetic defects in TSC. This includes exploring gene therapy and other novel approaches to correct the dysfunctional mTYR pathway. Scientists are also working to identify biomarkers that can help predict the severity of TSC and guide treatment decisions. Understanding the complex interplay of genetics, mTOR signaling, and the development of tumors in various organs is key to unlocking future treatments and ultimately a cure for tuberous sclerosis complex.